besides the fact we need to maybe brush more. Let's check in right now with Dr. Spiker Davis. He joins us live from Cosmetic Dental Associates with the latest. Good morning to you, and you're so thankful you're taking time to talk to us about this. So what's up with gum disease and all this inflammation in the mouth that are causing more problems for patients?
As you know, Melissa, on my blog, we always talk about the connection between gum disease and all kinds of other health issues. But lung issues, pneumonia issues, all kinds of issues, we've known for years that gum disease can affect that. Well, this dentist in California decided to do some research, and what they discovered is that many of the people that died from COVID also had gum disease existing in their mouth. So now it appears that the gum disease is a comorbidity, just like diabetes, just like heart disease, like all the other symptoms. And what they've discovered is that when you have gum disease, your body releases this protein called IL-6. And IL-6 is an inflammatory thing, so it inflames your gums and it inflames your lungs. And along comes the COVID, and now you're in big trouble. And in theory, you end up on a ventilator. And about 64% of the people on a ventilator don't survive. So huge connection between gum disease and between the COVID. I mean, it's just devastating. So we got to make sure we get our gums in good shape. And that doesn't mean just a little bit. I mean, we need to be flossing daily, brushing daily, rinsing with a mouthwash. I personally use a mouthwash with alcohol or hydrogen peroxide because that will tend to kill the virus that's in your mouth. So yay.
Yeah, no, seriously. I mean, and I'm so glad that UCLA brought this to our attention so that we can make sure our viewers know all about it. Let's talk about what gum disease is in the first place, because I think people hear that and they might not understand what that means. So can you explain that?
Sure. You know, the unfortunate thing is that if you listen to the CDC, about 80% of Americans have gum disease right now. Now, there's varying degrees of gum disease. It can be a little bit of inflammation, like bleeding of the gums, or it can be severe, like bone loss and losing teeth, or anywhere in between. But the cause of gum disease is bacteria in your mouth. And we all have zillions of bacteria in there. Some of them are good, some of them are bad. But the bad ones can cause infection. And so that infection gets into the gums. And the way to prevent that is by removing the bacteria. So we gotta floss, we gotta brush, we need to rinse with a mouthwash that kills those things. So if we do all of that, then you probably won't have gum disease. Of course, a big portion of that is going to your dentist and getting your teeth cleaned, and let's catch it in the early stages rather than wait till you have bone loss and tooth loss. So gum disease is a bacterial infection.
And it's good to know that it is reversible if you take care of it. Now, what about tobacco? Does that increase your risk of gum disease?
Absolutely, especially smoking. In fact, my own personal research is that all my patients that are smokers, 100% of them have some form of gum disease, either inflammation or worse.
All right. Well, Dr. Spiker Davis, thanks for your time today, and a reminder to only brush and floss the teeth that you want to keep, right? Good
That's
to
right. You
chat
don't have
with
to
you
floss
today.
them all, just the ones you want to keep, and then the ones you want to prevent COVID from getting in there. So stay healthy, brush, floss, and go see your dentist and get your teeth cleaned.
All right. Great to see you this morning.
Take
Let's
care.
check in with Mike now. And Mike, you were all right, you do the same.